Here at THV 11, we are focused on saving a generation, educating you about the opioid epidemic. A lot of the focus of the opioid crisis is on young people dying of overdoses because the numbers, they're staggering. But there's another generation that's also affected, seniors.
We were taught, if the patient says they have pain, you need to believe them. Then the opioid crisis hit and we realized that everything we knew was wrong.
A lot has changed since Kathy Busby started her career as a registered nurse 38 years ago.
At the time, we were teaching about pain being the fifth vital sign, that certain opioids, if you took them for pain, would not be addictive. Well, that was certainly wrong.
Which is why she knew she needed to educate herself, not only for her sake, but for her patients, many of whom are older. That's when she found OPAL, or Opioid Prevention for Aging and Longevity. The grant-funded program at the UAMS Reynolds Institute on Aging is aimed at preventing or reducing opioid use among seniors.
What we haven't been so attentive to is the fact that many of the opioid prescriptions are given to older patients.
The program is aimed at adults 55 and older and teaches valuable information about opioids, their side effects, and risks.
We also let them know the complications because older persons, they already have a predisposition to have many other vulnerabilities.
I'd rather deal with the pain on my own than take that strong drug.
Joyce Brewer says OPAL has taught her about how to talk to her doctor about her medications and alternative methods of pain relief like exercise, yoga, and even dance.
It would behoove people as we get older to find out more about ourselves, because you don't know, you've never been this age before. So when things arise, you need to know how to take care of it.
For both Busby and Brewer, it's good information to have no matter your age.
You got to make sure you do things right in order to stay here. Longevity is a good thing.
I think this is so important to have seniors educated on this. Think about our grandparents, our great parents, and everything that they've learned. Things have changed since then, and I think it's important to talk to your doctor if you don't feel comfortable about a medication. It's not making you feel well. Have that conversation, and that's what this class is going to help you do: is understand the risks and the benefits.
Yeah, it sounds so important. I think a lot of times seniors kind of get the shaft where they don't know all the information, or for some reason it's just not conveyed to them. So this sounds extremely important.
Yeah, and guess what? The next OPAL class is this Thursday, the 30th. For more information, we're going to have a link for you on thv11.com.